today I'm talking with Dr. Jamie Faught from Appleton Clinics, which is the DPC located in Eagle, Idaho. And this is the Boise Wellness Podcast, where we help connect people in the Treasure Valley to wellness professionals. So with that being said, if you've been thinking about joining a DPC, or you're curious what a DPC is, or maybe you've been specifically considering Appleton, this is going to be a good chance for you to get to know one of the doctors there, Dr. Jamie. So that's what we're talking about today.
Yeah, thanks for having me.
Perfect. So first off, can you explain what a DPC is?
Yes.
Direct primary care or direct primary care.
Right.
What is that?
So direct primary care is a membership-based clinic. So we don't take any insurance. There's no co-pays. There's no fees for the visit. It's based on an annual or a monthly membership. Mm-hmm. Important distinction between concierge. So concierge medicine, there's often an annual retainer fee to have that provider, where direct primary care is simply like a membership base, just like for a gym membership, or it's $99 a month for Appleton Clinics. Yeah. And the first 2 kids are free. And again, we don't take insurance. If patients have insurance, which is great, we can always use their insurance if they're going to have imaging or referral to a specialist or certain labs. We can always arrange for them to use their insurance, but we don't accept any payments from insurance.
And now I have 2 questions. Why would somebody consider that? And then why did you consider it? Why did you go that route?
Well, I'll answer the first one first, your first question first. Someone would consider that for a few main reasons. One is the focus of direct primary care is affordability. So that $99 a month is probably about the same as someone's cell phone bill, maybe. Yeah. And again, that's for the whole month. You could be seen every day if needed. But so affordability. As we know, like healthcare costs are rising, and it's very expensive to see the doctor or to have health insurance. And often those costs are hidden. I think the stat is 25% of people don't seek medical care because they're not sure how much it's going to cost. Yeah. So $99 gets you in to see your provider. So one is affordability. The second is accessibility. I don't know if you've tried to see a doctor in the Valley, but I think when I tried to make an appointment with a traditional clinic, I was going to be booked out for 6 months. So I think accessibility, that wasn't going to work for me. I don't know about you, but when you need to go in and see your doctor, you want to be seen usually in a timely manner. And so at Appleton Clinics, we have same-day appointments. We can get patients in generally for a wellness visit within 2 weeks, and then for same-day appointments, if there's something more urgent going on, we can see you that day. So accessibility would be the other reason. And then I think the quality of care is really important. So to explain the traditional healthcare model a little bit, and I can kind of get into the weeds of that, but they're often 15 minutes appointment, they're rushing you through, they just have to see a lot of patients in order to make the overhead. And so with this model, you have twice as much time to spend with your provider. Okay. And so that's really important to patients. They get to know their provider gets to know them, and really provide quality of care.
Yeah. And so then a question I think that came to my mind when I was learning about DPCs is, how do you not just get swamped with calls and meetings and working long hours because you're just open to it? So what are your thoughts on that? If somebody said, well, can I actually come see you, or are you just busy all the time?
Right. Well, the way that we see it now, when I was in the traditional model, I had over 3,000 patients in my panel, and that's crazy. That's a lot.
Yes.
And I was working way late hours to 10 o'clock sometimes just to get the paperwork done. In this model, because of the lower overhead, each provider in a direct primary care model may have somewhere between 400 1,200 patients. Okay. And that's much more manageable, so that you can be seen and so that provider can take good care of you. Also, people are often working and want to be working and doing fun things and outside with their family. They don't necessarily want to access the doctor's office if they don't have to, but if they need to, we have phone appointments, we have portal messaging, patients can come in for visits. And so I feel like people don't really abuse that.
Okay. Yeah. What is some of your background and journey that got you into health and wellness, being a healthcare provider?
Right. I mean, I think my interest in helping people and my interest in the human body and science happened at an early age. I'm from Colorado originally, and I went to Virginia for undergrad, and then decided I was going to pursue medical school, and I went to the University of Sydney in Australia
I saw
for
that.
medical
That's very
school.
interesting.
So that was a really neat experience. And I think they have a different healthcare system. They have a public and a private system. And I think that gave me I think an opportunity to see a different way of practicing and a different approach to medicine. And so when I came back to the United States, I think I've always been interested in again, taking care of people. I think the human body is fascinating. And so that has been my interest in medicine. So as far as direct primary care, kind of what I alluded to before, I was in a traditional practice from 2011 to 2018. And I mean, I had 3,000 patients, and I had to see 17 patients a day just to pay my overhead. And so that's very
Just
busy.
to cover overhead.
Just
So
to
then on
cover
top of that, you had to keep going.
Right.
Which makes for those quick 15 minutes.
Yeah.
I think
Yeah.
a lot of people would agree they maybe aren't a huge fan of
Right.
the way they see the
Right.
medical system going.
Right. And it's not very fun for providers either. I mean, you don't
Yeah.
get to really spend time with your patients or take care of their issues, and I think in the way that you want to. And so I also, just with that kind of administrative, the insurance fees, the reimbursement's just getting lower and lower. So I don't know where it is now, but I know that providers have to see even more patients just to keep to keep the lights on.
I have a friend who's a retired doctor in Canada, and he made a comment. He's like, when I went through medical school and the doctors I talked to, it was this mindset of like, I love being a doctor. I'm going to do this till I die. They don't think about retirement. They're like, I love it. But he's like, you talk to doctors now, and they're so slammed, and they're like, I think about retirement multiple times a week because
Absolutely.
the system is just kind of kills them a little bit.
Yeah, exactly. I think the physician burnout rate right now, especially in primary care, is like 61% or something.
That's crazy.
Which is
I don't
crazy.
want a burned out doctor to be saying that. I'm like, I want you to
don't.
be alive and rejuvenated and not
Yeah.
swamped and thinking about overhead.
And I think that's where I got to the point in the traditional model. I was just like, can I do this for another 25 years? And the answer was no. Like, no, it was absolutely killing me. So that's why I moved to Idaho and helped open up Appleton Clinics. And it's been a great, great change. I could never go back.
Perfect. In this model where you get to know your client a little bit more and spend more time with them, what's some things where you've seen like, man, I've seen this to be really helpful for the patients?
Right. I'm trying to think of like a very specific example. I think in general, what I have really appreciated about this model is and I think with that, the first two kids being free, like we really are seeing the whole family.
Yeah.
We see the mom, the dad. I often see grandma when grandma like moves, in with the family, the kids. And I think it gives the whole picture to what's really going on. And I love when I see those patients back, even as individuals. I really, can ask about I don't know, how is the gymnastics tournament or, what's going on. And I just think, it's such a privilege, actually, to be part of a patient, a part of families, a part of community in that way. I think it's, in a way, not to be weird, like an intimate, but really a close relationship. And I really, I take a lot of like honor and like pride in that. Yeah.
That's really exciting. Let me just look at this again.
I can tell you a specific story that I think we had a young girl who broke her arm. This is an example of what happens at Appleton, who needed an x-ray. They wanted to come in, but just didn't quite, thought the arm was broken. So we sent an order over for an x-ray. The patient went to get the x-ray, came into the clinic. We reviewed the x-ray. It was indeed broken. And so we were able to cast her in the clinic. And as the parents left, they're just like, okay, what's the charge for this? Kind of expecting a big bill, and there was no charge.
It was just included.
It was just included. Yeah.
How often do people have to go outside of your DPC care to get other things that aren't offered within the service? For example, like a cast is something you guys can do in-house.
Yes. So we're standard, like primary care clinics. So we can do laceration repair, we can manage fractures, we can do skin biopsies, we do wellness visits as well, like pap smears. And we understand we have some patients who have insurance, we have patients who have Medicare, we have patients who have Medicaid, but we also have patients who don't have insurance or have a high deductible. And we're very aware of that. And so we try to either one, manage as much as we can, safely and competently in the clinic. And sometimes that even includes, I will send some of my orthopedic colleagues or maybe my dermatology colleagues a picture of this or a picture of that x-ray. Do you want to see this patient? Is this something I can manage? How would you direct me? And so to really, again, have those relationships with those specialists so we can kind of save our patients that cost or that, that visit if we can manage it there. If not, then it is a referral. I think we refer for really, when it's needed, very serious things. I don't know, probably 1 in 5 patients needs a referral, not on a daily, not on every visit, but on average for something. Yeah.
This is a question for you. So what's your guys' take on if somebody were to come to see you, there's the, hey, I broke an arm, hey, I need a stitch, or the immediate need things. But then there's the, hey, if you were talking to me, you're like, hey, Craig, you might think about changing your diet to affect some better health over the next 10 to 20 years. Or, hey, you might think about doing this so that you don't have to see me for these things. What's your thought on proactive suggestions?
Oh, yeah, for sure. Yeah. I think, I don't know if do you follow much of the podcasts or for wellness, like Peter Attivara or longevity or any of those things?
There's one, I don't know. There's one guy, I don't know the names. There was a guy on Jordan Peterson's podcast that was about cancer and longevity and life. And that me and my wife have been talking about hey, if you want to be able to lift up your grandkids, it's you kind of got to be doing these things right now.
Exactly.
So that probably falls in that category. But what are your thoughts on that?
Yeah. So we have, we want a annual physical every year. And during that exam, it's going over your family history, if there's anything there, your past medical history, what surgeries have you had, are there any cancer screenings that you're due for based on your age? And then doing the physical exam as well as the labs, which are covered under the membership. So no cost to you. And then as those labs come back, we reach out. And if there is something to see, your cholesterol is high or your blood sugar is high, we need to address those things now. And we try to go, I'm not a big pill pusher, I try and do natural things first. A lot of things are lifestyle, especially in America. So healthy diet and regular exercise. So I try and look at those options with patients first. So I have some patients who want to do herbal or kind of natural. We can kind of look at the data for those things. And then sometimes it does require prescription medication. So in those cases, we talk, weigh the risks and the benefits of doing that.
Okay. I think this is my final question, unless you want to add, but just out of curiosity, if I were to sign up at Appleton, do I pick a doctor? Would I interview you guys? Would I pick you? And then the question is, say I have to come in for a quick visit too. Do you guys, would I have to get you, or you're like, hey, I'm not available, but so-and-so doctor's available, he can see you? How do you guys handle that?
Right. So signing up for Appleton Clinics, you will be assigned a provider. It'll either be right now myself or Dr. Britta Beasley. And so that would be your primary care doctor. We do like to set up an initial visit where we can we go over all your records, or if there's anything that we need to get from previous doctors or specialists or again, just to help take good care of you. And then you will see me as your main provider. But if there was a time that you needed to come in and I wasn't available, we have Dimitri, who's our physician's assistant, who's awesome, who will do has availability for same day appointments if I don't.
Great.
Yeah. We try to keep you with your provider, but there are just some of those times that if you need to be seen, you'll see Dimitri. A lot of times, patients don't necessarily know if they need to come in. They just want to send us a picture of that rash, over the portal, or set up a phone appointment to kind of go over some things. And then sometimes at that point we determine we should probably see you for that when you come in. And
that makes sense.
Yeah.
But you do give people the ability to kind of engage with you without having to drive out to Eagle.
Yeah. Yes, for sure. We do at least like to see you once.
Yeah, that'd be nice. But some things you're It's nice though.
Right.
One more thing that I want to add is that if you're an employer in the Treasure Valley and you're looking to offer healthcare services to your staff, Appleton can offer something in that area.
Yes, we do have corporate memberships, so employers can add this benefit for their employees.
Yeah.
Again, it's the same price, the $99 a month. I sometimes see employers will pay part of that or they'll just offer it. There's a few additional benefits to having that service at Appleton, but otherwise it's a great way to reduce the premiums for the insurance that the company may be offering otherwise. There was a statistic recently that having a direct primary care membership, at least for those claims through employers and when they're using their insurance, reduced ER visits by 50%, reduced hospitalizations by 25%, and overall reduced those premiums by about 30%. So I think it is really awesome to pair that with insurance.
So this could be a good way for an employer to keep costs down while at the same time probably taking better care of their staff.
Absolutely. And again, with that, all kids are free. So yeah, it's really helpful for families and employees.
Okay, perfect. Well, hey, that's going to wrap things up. If you want to go see her or you're curious to learn more about it, we'll leave links in the description down below. But hopefully this was helpful to you guys as you're deciding who you want taking care of you here in the Treasure Valley.
Thanks.
Perfect. Thank you. Hey, we hope you guys liked that show. If you're curious about any links to the professional we just interviewed, you can see that down below. But just a little bit about us. I'm one of the hosts, Craig Flood. I'm a local real estate agent and helps people with residential and commercial listings.
My name's Trevor Schmidt. I'm a physical therapist at Activated Movement Physical Therapy.
And we came together to make this podcast to help people here in the Treasure Valley find wellness professionals so that you guys can live a healthy and active lifestyle.